Hello, good morning, one and all. Welcome back to another program. This morning, we're shifting gears a little to focus on lupus awareness as October is celebrated as Lupus Awareness Month in Jamaica. But it is often overshadowed because it shares with Breast Cancer Awareness Month. However, today we have an inspirational story to share with you today, a story of strength, faith, and also survival. And it's the story of Stevenson, sorry, Deneka Simpson, who is, I don't know where I get Stevenson from, who is a living testimony as she shares her journey with lupus with us today. We also have another guest, Dr. Shion Betty. He is, let me give a proper introduction. Dr. Betty is an internist with over 11 years of experience in medicine. He's a committed Christian. He believes in faith, family, and evidence-based care. Dr. Betty currently practices in the United States and also serves patients here in Jamaica. Whenever he's here, he works at the Bethesda Medical Limited in Junction in St. Elizabeth. He studied at the University of West Indies and completed his internal medicine training at Piedmont Athens Regional in Georgia, USA. Hope I get that correct. And with a passion for healing and a deep respect for God's design of the human body, Dr. Betty is here to share his knowledge and insight as we walk with Deneka this morning with her lupus journey. So, Dr. Betty, can you explain for those who don't understand what's an internist or who's an
Right.
intern?
Thank you for having me.
Yeah.
So, an internist is a medical doctor who had completed postgraduate training, meaning after they completed their 5 years or so of medical school, you went on to do further training, an additional 3 to 4 years,
Yeah.
focusing on medical conditions affecting adults, male and female. Where it's not a surgical specialist at all, so we deal with more of the medical aspect of things. We do see surgical patients, however, in the before surgery and after surgery to ensure that everything is okay with them, to optimize them for recovery and optimize them for surgery as well.
Okay, okay. All right, thank you. So tell us before we allow Deneka to introduce herself, tell us, Dr. Betty, what exactly is lupus?
Okay, so lupus is basically the short term of the disease. The actual full name is systemic lupus erythematosus, right? And that's a mouthful. So systemic just means it is a disorder that affects the entire body of the patient from head to toe, basically. Um, Lupus is actually from a Latin word that means wolf bite or wolf, because they felt that the rashes that patients with lupus get, they look like the bite of a wolf. And then erythematosus is just a medical term that means reddening of the skin, because that's how the rash
Mm.
looks like that the patients get, right? But we commonly
Okay.
call it lupus for short.
Okay,
And
okay.
to give you some additional information about what lupus is, it's an autoimmune disorder, right? It's probably one of the more common ones, and it results when your own immune system is making antibodies against itself. Usually, your immune system is there to protect you from viruses, bacteria, so forth that can be coming from the outside to affect you. But here it is that in this condition, your immune system turns against itself and now it's attacking its own cell. And that is the basic way in which all the symptoms of lupus occur. Your own immune system is attacking itself, and you get a tremendous amount of symptoms from that.
Okay, thank you. Thank you so much. All right, so Deneka, can you just give us a brief introduction? Who is Deneka Simpson?
Good morning, Dr. Betty. Good morning, Shan and viewers. I
Morning.
am Deneka Simpson.
Good
I am
morning.
8 years old. I am a daughter of the soil, the breadbasket of St. Elizabeth. I was raised between Nain and Southfield. I am a lupus warrior. I attended the BB Cook High School. I then moved on to Southeast, where I did a course in practical nursing, and then turned a caregiver and a entrepreneur also.
Oh, awesome, awesome. All right. So, Deneka, can you share with us a little bit about your lupus journey and how you discovered you had lupus?
Well, I actually, my discovery is actually a testimony. It is indeed a testimony of God's goodness towards me. On this day, on my grandmother had just passed, and she returned home for her final rest. And after the whole event of the funeral and everything, some of my family went back and some was here. And on that morning, I just got up and we were all out on the veranda, friends and family, a bit of friends and a bit of family. And while I was there sitting with them talking, I just felt a bit tired. And I just told my mother that I was going inside. I was going to lay down for a bit because I was feeling very tired. But it all started with aggression
Mhm.
throughout the whole time of dealing with death and stuff. I was very aggressive, and one of my aunts was saying that something was wrong. So on that morning when I went inside, and another member of the family, one of my aunt's niece, was in one of the rooms that I went to lay in. And when I went there, I told her that I was very tired and I just wanted to lay down. So I asked her to, just scoot over, let me just go over on the bed. And I went over on the bed. And when I went on the bed and I laid there, she then turned around and said she realized that I wasn't breathing. And she ran out the room. And she went back and she shouted to my mother that I just came in there and lied down and I wasn't breathing. And when they came and my mother looked at me, she said that I was literally dead. There was no pulse, there was no heartbeat, there was no breath, nothing at all. Everybody started out to scream. The neighbors came. One of my neighbors said when she came in there, I was cold. I was dead, lying there dead. And a cousin of mine and another family friend just started to pray. And when they started to pray, everybody was on the veranda crying out. And I just, out of nowhere, I just got a breath and I got up and I walked to the door and I said, "What's the noise for? Did somebody die?" And everybody just turned around and looked stunned. Everybody just was in shock. And I was taken to Junction to a doctor. I was rushed to a doctor in Junction because after that I had no memory, no recollection. This is just what I've been told. I ended up lost in my memory, lost in basically mobility, everything. But it all started from 2 years before, where I started having a lot of asthma attacks. My system just wasn't working as it was supposed to be working. I started having a lot of allergies and stuff like that. So that's just how my journey began.
Oh, okay. And you didn't have asthma before, you didn't.
Yes, I used to suffer from asthma, but it just became
Okay.
rapid, some rapid attacks, and the aggression was just too much.
Okay. So you said it started 2 years prior to you finding out. When exactly did you found out you had it? What year?
In
Could you
January of 2020.
right, right. So what were some of the other symptoms you had before?
Oh, this one is a lot now. I started the butterfly rash. The butterfly rash came out on my face because my second trip to the doctor, I then moved on to Mandeville where I started seeing another doctor. And the first time I walked in the office, he said, "Oh, I don't have to go any further. Miss Dempster, your daughter has lupus, but for further investigation, you will have to do some tests." And he recommended me to go to the specialist down in Hargreaves, Dr. Davis. And then the whole rash, the butterfly rash, the eyes, became dark. I start having um, a lot of memory loss, seizure,
Oh,
just a massive weight loss. When I mean massive weight loss, I mean like I went from a medium to a extra small in size. Just being skin rash, seizures, mobility issues, have to be held to walk. I had to be taken into Kingston to wire my brain, to do body scans, all of that. And with all those tests and stuff, I saw the rheumatologist and it was confirmed that I have lupus SLE, that's systematic lupus erythematosus. We shorten it
wow.
by SLE.
Okay, okay. So wow, what a story. So how challenging has it been for you, like on a daily basis? How has things changed for you?
Things has changed. The fact of just getting up out of your bed, using your hands, your mobility, not being able to even prepare a meal for yourself. I live by myself, and for the first 6 months, I wasn't able to live by myself. My mother had to come and make sure I was properly cared for. And another thing that with lupus, the anemia kicks in, your blood count will just drop. So it causes weakness. So I basically lost my mobility, not being able to prepare for myself, not being able to look after myself. And I was an outgoing person and a hard worker. So not being able to do what I'm accustomed to doing, it took a toll. And with lupus, you are hit with depression.
Yes, yes, yes.
So that's
So
one of
so
the
how go ahead, sorry, go ahead.
depression is one of the main thing with lupus.
Yes. All right. So what kind of support do you have from family, friends, or church, your church
Well,
members?
the main support is the financial support, because without the financial support, there would have been a me,
Yeah.
because the cost of living with lupus is enormous. You
Yeah.
cannot
And you
walk
here.
without having over 200,000, going on to 300,000 when I just started out.
Wow.
And blood work, not to mention the blood work, and it was like a monthly thing. So I had
Mhm.
my family financial support. I had the church who was also praying. They keep coming. They had prayer meetings, and just the wider community,
Wow.
because people would have seen me, and I'm not able to help myself, and I would have neighbors come over, cousins passing, or you want something to lift, they come and lift it, because I wasn't able to do. I'm still not able to do certain things. The
Mhm.
sun is one of the things that affects my daily life, because I have to be avoiding the sun.
Right, right. So
One of the things.
you told me prior to this interview that you have to be taking a lot of medication. Can you share with us how many exactly and how has these medication affected your body?
Well, the medication was like, I think I take like 23 tablets per day, including supplements. Um, well, some of them, it changes your appearance. So at first, when I started taking like the prednisone, and I just blew up from a size extra small to a, because it changes the shape of your face. It gives you the hump on your neck, back, and it just blow you out of proportion. So that
Mhm.
took an effect on me. People not recognizing me when I go out. Even in my very own church, I went to a church and they were asking me, Miss, is it your first time here? Because I was unrecognizable,
Wow. Wow.
because it changed my whole feature.
Your whole appearance, yes. So Oh, Dr. Betty, how uh how can I put this question? Um, how how is the how available is the treatment of lupus here in Jamaica? I might be putting you on the spot, but um, are you aware? Yeah.
Well, first of all, thank you, Deneka, for sharing such a inspirational, story. And you said so much things that are so common to patients who suffer from this condition. So it's remarkable your journey and how you have recovered. So I want to thank you for your story and for sharing with us today. But for lupus, not only just lupus, but for like other autoimmune diseases, um, the treatment is very difficult to achieve, not just in Jamaica. I must tell you that also in the United States and I'm sure other countries as well. It's one of those, the entire field of rheumatology is a field that is developing. So they're just figuring out a lot of medications to treat these conditions. Many of them are the more newer ones are very expensive, and some of them not even available in Jamaica as yet because these are what we call infusion medication that you have to go and get the injections every couple of months and so forth. The older medications is what we have in Jamaica, the steroids. So steroids are very commonly used, but as Danica was explaining, they have very terrible side effects. Not just what she mentioned about changing her appearance, but it can increase your risk for developing diabetes, bone fractures, all kind of horrible side effects. Get the Cushing syndrome that she was describing with the buffalo hump, right? So that's not a medication that you want to have the patient on for too long. It helps to put out the fire of the flare, calms down the disease, but you want to get the
Mhm.
patient off of it as quickly as possible or on the lowest possible dose that they can tolerate without having any symptoms. So the other medications, a lot of them are not even safe in pregnancy, and you have to understand that lupus affect young female in the reproductive age. 15 to
Oh,
45 thereabout is the age group that's most commonly affected. So you have to also consider the fact that a lot of these patients they want to have children, but the disease itself can affect their fertility, and the treatment as well can affect their fertility. And you don't want to get pregnant on some of these medications, so you have to also think about that because it can affect your baby, right?
oh,
So there is still a lot of development that is needed. I know the government is doing a lot through the NHF with a lot of the medication, the steroids, the hydroxychloroquine, the methotrexate, and so forth. But there are so much more that needs to be done, especially for the newer medications that I mentioned, the infusions and stuff like that, that may be beneficial, but it's really expensive, and probably that's one of the main reasons why um, it's not available in Jamaica. The other thing is the access to care. So there's not a lot of rheumatologists available across the island.
mhm.
So you may have to end up going to Kingston or Montego Bay, one of the bigger towns or cities, to find a rheumatologist. And not a lot of doctors are very comfortable with managing lupus, unfortunately, and other rheumatologic conditions, just because of how um, the medications are very toxic, and it can be a very complex disease to monitor, to know when to do what blood test to monitor and the blood test to do and so forth. So oftentimes these patients end up having to go to Kingston, or they end up at KPH, one of those public hospitals, and it takes forever to really get the turnover and the care that they need. So I think having more rheumatologists available across the island, whether in the private or public sector, will definitely reduce the burden of the disease. And as I said, it affects you during your productive years. I feel so bad when Danica was saying that she can't even move. And she, of course, if she can't move, she can't work. So it's affecting her productivity. She can't take care of herself, right? This is her in her 40s or so forth. So this is her productive years of life. So it has a really significant impact, not just on the patient, but also on the community, on the country, on the economy. Because
Yes,
once
yes.
you're sick, you can't go to school, you can't go to work.
Thank you so much, Dr. Betty, for that. So, how serious though? Because we hear about lupus, but and we hear about cancer, but how serious is the disease, lupus?
It's so serious that I don't think a lot of people understand lupus itself, and it's a lot of people lose their life over it. You can die at various stages from different complications of the disease. Younger patients tend to die from infection-related illnesses, because a lot of the medication that you take for lupus, it suppresses your immune system. Because remember, the disease is your immune system is going out of whack. So they get the steroids, they get these other medications that help to suppress the immune system. So during that phase, they can develop bad infections. And I can't over. I remember her saying that she got diagnosed in 2020, and we all know what was happening then. That's a scary time to be diagnosed with an autoimmune disorder and to be
It's
on steroids and to be on immunosuppressive therapy, right? People were dying like hot bread with that condition back then. So that's a big thing
Yeah.
that caused a lot of death. They can die in childbirth, right? There's a high risk for them to die and the baby to die during childbirth. They can end up getting clots in their leg, which can move to their lung and cause a pulmonary embolism, right? Because they're high risk for developing clots. They can develop cancer, not only from the disease itself, but some of these medication that you use to treat the diseases, like methotrexate and so forth, they can increase the risk for lymphomas and so forth. So it's such a deadly disease from all angles. And if you don't know, the big thing is to decide, is this patient having a flare versus are they having something else, right? A lot of times when a lupus patient have a fever, you have to be serious about it. It's not like another normal person having a fever. You have to decide what's going on here. Is this a flare? Is it a cough or cold? It's a pneumonia. You have to treat them very, very, very carefully because they can die very quickly, right? So you have to have a very low threshold to manage these patients. And that's why, unfortunately, if we don't have the specialists and those physicians who understand the disease process, a lot of these patients may not get the treatment they require, or they may be misdiagnosed or have delayed diagnosis and all this. And because it's such a wide disease, a lot of patients don't even present with the rash, but they have
yeah.
these non-specific symptoms that develop. Sometimes the disease takes months for you to make the diagnosis, right? Some patients will come in with the classic findings, but a lot of patients, they may have this non-specific, oh, my joint hurts, oh, I'm having fever, oh, I'm having weight loss, very non-specific symptoms, but it will develop over time. So you have to have a very close relationship with your physician, and they continue to monitor you closely, because sometimes, as I said, it will take months for you to get that diagnosis. And during that time, the disease is raging ravish on the patient body.
Wow, that is indeed a mouthful.
Adhere to that, doc. Um, during the course of my going back and forth to the doctor, I wasn't diagnosed, and eventually the inflammation went to the brain.
Right.
Oh,
Yep. That's very, 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 very common, because, as I said, the symptoms can be so, and sometimes you're not even thinking about it. Most doctors may not necessarily be thinking about it, and the symptoms are so non-specific. And as I said, while you're missing a diagnosis, the disease is causing a lot of destruction in the patient body. So it's something that you have to be aware of. Young female, non-specific symptoms have to have a low threshold to say, hey, could this be lupus, and what should I be doing right now for this patient?
So, Doc, I hear you speak specifically about female. Is it a female only disease?
no.
No, it's not. It predominantly affects female, especially during the reproductive age. And one of the reasons for that is estrogen somehow plays a role in the disease process, because after menopause, the rate for men and female is pretty much equal, but it does affect male as well, but not as much as female. And that has to do a lot with the estrogen factor as well. In general, autoimmune diseases, even like rheumatoid arthritis, scleroderma, other things, those diseases tend to have a female predominance, but they do affect male as well. So, of course, you have to look out for that as well in your male patients. And
Okay,
if
thank
you
you.
think it's missed a lot in females, it's even missed more in males, because you're not expecting it. It's less likely. So, for example, for every 10 female that is affected, maybe you have one male affected. So a 10-to-1 ratio, the doctors are probably not gonna even suspect it in a male, but it can happen.
So, is this disease something that's genetic?
Yes, absolutely. It does have some genetic. Yes, it does. Um, it can. Not everybody has a family history of it, but there is some genetic predisposition. Most diseases actually do have genetic predisposition. So you will notice that patients who have lupus, they may have a mother or aunt or grandma that has the disease. Not necessarily lupus, but remember there are other connective tissue diseases which are linked. They come together. So you may not necessarily have lupus in the family, but maybe you have an auntie that has antiphospholipid syndrome, or they have rheumatoid arthritis. But the constellation of diseases may be there. Some patient may be the first case. Maybe I don't know about Miss Simpson. Maybe she's the first case.
First case
You will find that as well, that she may be patient 0, patient 1, the first case in the family. But there's a strong link with genetics. And oftentimes, those patients who have a genetic predisposition will get diagnosed earlier. So it seems that Miss Simpson was diagnosed a little bit later in life. Again, maybe she didn't have that genetic composition, but maybe it's just environmental trigger. She's the first one in the family. But somebody with a strong family history, you'll see them getting diagnosed at 15, at 20, 22, very early on in life because of that additional risk factor of genes.
Oh. Thank you so much. Back to you, Deneka. What are some of the common misconceptions people have about the disease and what you would like them to understand more?
This is one of the most common. It is not cancer. It is not cancer. It is an autoimmune disease, not cancer. It is not catching. You cannot catch lupus. But what can hurt me is your germs can kill me.
Right.
It is not catching. It is not cancer.
Wow. How has lupus changed the way you look at life, love, and faith?
Lupus has changed me made a change to just love and appreciate life. Because each morning you wake up, you see a new day,
It's a
you're
gift.
grateful, you're just thankful. Each time you can get out of bed, you are grateful, you are thankful. And just appreciating the people around you. Appreciating the church, appreciating the wider community, the family members. You have just changed into a different person. You are more watchful. Everything that concerns germs and stuff, you're skeptical.
Yes, understand.
And I love about the people around me, if they know they have a cough or a cold, they stay at a distance.
No.
So it's a life-changing event, and just taught me to be appreciative of life.
Yes. So, what advice would you give to someone who was recently diagnosed with lupus?
The whole thing about lupus is acceptance. They have to first accept that they have lupus. If they are going to be in denial, they are not going to get better. Depression is one of the most thing that depression is one of the biggest issue with lupus. You have to get yourself checked in with a counselor. You have to seek help. Join support groups. Watch what you eat. Protect yourself from the sun. Keep up with your appointments. Keep up with your medication. The medication is one of them, because you have to take the medication as prescribed. You cannot take it when you feel like or when you're feeling sick. You have to keep on a track with your medication. And for me, with my medication, I suffer memory loss. So I have to ensure that I have my container where it's packaged out, so that I don't miss a day, or I don't miss the time, or I don't overdose.
Right.
So they have to, and the next thing again, you have to learn about your body. When your body speaks to you, listen. If your body says lay, you go and lay down. Do not try to overwork yourself, because at the end of the day, you are the one gonna feel it. Take care of yourself, keep up your labs, seek counseling, because depression has a way of getting to you. With lupus, that is one of the main things that I would say is the enemy. Sunlight is the enemy. Depression is the enemy. Food can be your enemy. Because, say for instance, oh, you said vegetable is good, right? Having too much, having tomatoes and garlic is one of my enemies. So if you are going to eat and after you eat, you find out that I am in pain after eating this or after eating that, then you drop it. So I just say, listen to your body.
All right. So your whole story is
Love, love, laugh, and enjoy life as it comes. Because
yeah.
tomorrow is.
I was just going to say what message of hope you have for someone out there listening who might be struggling with the disease.
Live,
But you
love, laugh.
basically said it, but you can go ahead if you have additional.
Just continue to live, love, and enjoy life as it comes. Because tomorrow is promised to no man.
That's
Thank
right.
you. Thank you. Thank you so much. Your story is so inspirational. I have to tell you, you're really a tower of strength. You've inspired me so much. I saw your previous interview before, so I had an idea, but just speaking with you this morning and hearing you sharing it again, trust me, it really touched me. And
Yeah.
yes, and I'm so happy that Dr. Betty was able to join us as well. Dr. Betty, do you have any last message, final message to those watching?
Yeah, just to piggyback on what Miss Simpson was saying about depression, it's so underrated because when you are depressed, you don't feel motivated to take care of yourself. You don't feel motivated to go to doctor, to go get your blood test, take your medication. So it is something that can lead to a spiral where you can end up self-deleting yourself, if you know what I mean, right?
Mhm.
And it causes you to isolate yourself from your community, from your support group. And it's such
It's
uh, a serious disease that you will need support. You know, you will need financial support, emotional support, all the kind of support that you can think of, and depression will rob you of all of that. So it is something that is um, it is not spoken of enough, basically, about
Mhm.
the depression. So seek counseling. I can't help but notice in the news about the increase in mental health issues that we're having in the country of Jamaica. Um, if you have lupus, it's going to be tenfold, a hundredfold worse. So these patients, they need, you need your support. And I'm just kind of reaching out to the family here that if you have a family member that has this disease, you have to be that pillar of support for them. If you see them becoming more isolated, you have to step out and say, hey, what can I do to help you? You know, spend some time with them. Don't let them feel like they're alone during this because it's a long process. Imagine getting diagnosed at 15 and you have your entire life ahead of you. That's several decades of dealing with this chronic disease that could affect your reproductivity, can affect your job ability to work. So all these things that can cause depression, affect your relationship with people. And so it's just such a component factor, and we shouldn't underestimate depression in these patients.
Thank you, thank you, thank you so much for your insight, Dr. Betty. Thank you so much for sharing your story, Deneka. It's really a pleasure to have you both this morning. Um, this is where we're going to end it. Thank you guys so much for joining in, and I'll see you next time.
thank you,
Bye for
All
Shan.
now.
right.
Dr. Betty.
Thank you for having me. All right. Have a good one.
Bye.